So when we think about health literacy and sort of its definition, health literacy in the past has been defined around individual skills, and this idea around it's the degree to which individuals have the capacity to obtain or process and understand basic health information. So it was very much focused on the individual. And in recent years, we've actually started to see this shift where it's actually recognizing this dynamic that's happening in communication, which is usually, we want to be seeing a two-way conversation, and that there's the societal responsibility for the communicator to do a good job, to do a better job in providing information that can be understandable to a wide group of individuals. And so in recent years, the change has been to focus on how society can provide accurate health information and services that people can easily find, understand, and use to inform their decisions and actions. And so with that in mind, then, sort of thinking about the relationship, then there's also a number of other things that we kind of include, concepts that we include under the umbrella of health literacy. So we've talked a little bit about sort of numeracy and understanding numbers, statistics, probabilities, rates of disease, how that even includes things like dates and calendar information, calculating out weeks, medication information. So numeracy factors into these types of information that could be shared in a research context. Plain language, of course, is around using simple, understandable language, less syllables, shorter sentences, one concept at a time, different things like that that really help to make information clearer and more concise. Along with that goes clear design. So the idea that we are also going to present information in ways that are more appealing and allow people to be able to track the information in a more meaningful way as they come to it. So it's the way we lay things out, it's the way that we format things, it's the fonts we use, it's color, it's pictures or graphics that we include, and making sure that they are informative and also representative, which ties into cultural considerations and thinking about who are the individuals that comprise my audience and how am I going to best reach them with this information? How would I make it welcoming to them, and thinking about that. And sometimes that can be relatively straightforward if you have a specific population that you're trying to reach. And sometimes, like even for the work that I do, I'm trying to think about things so broadly and try to think about how many different groups I could reach with a particular resource that it can be challenging, but really wanting to do the best you can to understand what are some of the needs of the audience that I'm trying to reach, and how can I represent that in the information that I present to them? Further to that, then, the best way of making sure that anything that you've created is kind of working is to do usability testing. And I'll talk a little bit more about that in a few slides. But usability testing is a way for you to be able to ensure that you have met the needs of the people that you're creating something for. And so that is where you would get representative individuals to look at your content or the layout and the images and give you feedback on whether it's actually doing what you intend it to do. And then there's interactive techniques. And this really applies, of course, in scenarios where you're having some kind of conversation, whether it's in person, whether it's in our current world of virtual, over Zoom or a phone call. But what are ways that we can integrate strategies into those conversations to really reinforce learning, ensure that we as the communicators can recognize where there may be some misunderstanding and redirect and correct. And so building that into your workflow and processes.